addressing stigmas with African Americans and mental health. I'm sorry. We're addressing stigmas with African Americans and mental illness, and joining us today is Jan Desper Peters, Executive Director of the Black Mental Health Alliance. Welcome, Jan.
Thank you, Lisa.
Tell us about the Black Mental Health Alliance. What is that organization?
Okay, well, the Black Mental Health Alliance has been in existence for 30 years, actually. We celebrated our 30th anniversary last year. And it's a nonprofit organization that was created by a group of mental health professionals, Black mental health professionals, psychiatrists, psychologists, social workers, and even nurses. Senator Shirley Nathan Pulliam is one of our founders. And it was really created because they saw in the arenas that they were in that there was a need for increased cultural competence and cultural sensitivity as it related to the delivery of services and treatment.
And recently you all put out a large call to action calling all mental health providers to get together. And why did you do that, and how is that helping?
Well, we did it because, not just because of what was happening a couple of weeks ago or a month or so ago with regard to the uprising, because like I said, for a long time we've heard the cries of our people in the communities, and we've been providing programs and services, but the cries just were louder and louder. And so we knew that we needed to put out a call to primarily our members, because we have a membership component as well. And we summoned all Black mental health professionals and community healers to come together to talk about what we could do as a collective to bring healing to our community. And we think that that has us well on our way. We did, you know, we summoned people within 1 week, and then a month later we had another call, and over that 30-day period or so, we have created what we call an 11-step plan to really address what's going on in our community. And we're trying to be very thoughtful about it, opposed to just kind of diving in, doing things. And a lot of people are working in the community. We applaud them. We're also working in the community, but we're trying to be thoughtful with how we do that.
Because there's a lot of stigma about seeking help in the Black community for mental illness.
Absolutely, absolutely. And historically, our people usually have some mistrust about people that are talking about mental illness. They don't want to talk about it outside of their homes. I mean, culturally, we as Black people are sticking to, you don't talk about things that's happening inside of your home, outside of your home. You know, there's a historical piece with regard to experiments being done on people of color that were not in their favor. They were lied to, and so there's distrust as it relates to that. And so we don't approach mental illness or mental health issues the same way we approach physical health issues.
And so in the meetings that you all have had, what are the mental health providers saying about how mental health and violence that we've been seeing in our communities go hand in hand?
Well, the one thing that I noticed in the media, and this is not an indictment on the media, but that whenever there's someone that is perpetuating violence, the first thing they try to see is if the person has a mental illness. So first of all, everyone that is violent doesn't have a mental illness, and everyone that's mentally ill is not prone to violence. But you know, sometimes the two go hand in hand, and so what we're seeing is that we want to make sure that we have a plan, that people have a more creative way to deal with the issues that they're frustrated with.
Okay. And so in some of the communities where we recently saw that, you know, the riots and the unrest, people were angry. People were angry. They talk about not having anybody to listen to them. And so there are probably some underlying issues with, I mean, the trauma that these communities see in terms of broken homes, losing people. They're seeing people killed in these communities.
Right.
What kinds of services can the Alliance bring to them?
Right. So a lot of times when we think about post-traumatic stress, we're thinking about it in relationship to war. But people also can have post-traumatic stress just by living their day-to-day lives in their community. So when you see things on a day-to-day basis over a period of time, over a long period of time, then you also can have the same issues as a person who has experienced post-traumatic stress through a war situation. And so what the Black Mental Health Alliance does is provide resource referral. We have a membership component, as I said before, and people know that they can call, or people, if they don't know, they'll know after today. They can call our office and they can get the information, contact information for people who are culturally competent to see if they need to see those people. The other interesting thing that you said is that people don't feel like they have anybody to listen to them. And so the Black Mental Health Alliance has partnered with the Association of Black Psychologists and the Community Health Network, and it's a national organization. They've created this model called emotional emancipation circles, and we're actually have trainings to plant circles throughout the city to talk about, to give Black people the opportunity to come together, to talk about the issues that really affect them, to talk about the lies that have been perpetuated about Black inferiority, which we feel have led to the devaluing of our people.
And these circles would be something that's not going to cost a whole lot of money.
Oh, the circles are free.
Okay.
Yes.
All right, good. That's a good idea for many communities, too.
Yes.
So hopefully people will take you up on that.
We hope so.
Okay. Jan, thank you for coming in.
Thank you, Lisa.
All right.